The United Counseling Service of Bennington County offers a wide variety of social services to the region, from operating the county's Head Start program for early education to psychiatric and youth and family services and several others. Two of the areas they were involved with before the COVID-19 pandemic arrived were opioid abuse assistance and mental health services in general. To find out how the agency has been able to keep going on those fronts, which were being closely followed before the pandemic upended everything, we talked with Lorna Matern, the Executive Director of UCS, and Lori Vatican, the Director of Mental Health and Substance Abuse Services. Here's what they had to say.
We had a lot of people prior to this. We were very much concerned about the opioid epidemic and people who were struggling with mental health issues. And I guess I just wondered, has the pandemic kind of made all of that work more difficult than it already was? I would imagine it probably did, but I guess I just thought maybe we could start there and have you talk a little bit about that.
Certainly, the simple answer to has the pandemic affected substance use and mental health issues of our community, the simple answer is yes. We have seen certainly a significant spike in people calling for services, people who are calling who are feeling anxious, who are feeling depressed, isolated, and needing support around those feelings and what that brings up for them. And also feelings of trauma, experiencing trauma around the pandemic and about what's going on in the world. And then, of course, substance use, which I'd love to have Lori talk a little bit more about, that for a little while, everybody kind of hunkered down a little bit when the pandemic first came in, and now people are starting to surface again, and certainly greater use of substances, and not just opioids, because alcohol is still the primary substance of choice. But Lori, do you want to take that?
Sure. Yeah, sure. And so the trend from COVID-19, unfortunately, is that there is more relapse. We're seeing more people that have been able to sustain sobriety struggle and they're relapsing. We're also seeing that the stress, the calls of them feeling angry, irritable, restless, having racing thoughts. They'll often report not knowing what's wrong. It's just this chronic period of time where it's hard for them to self-soothe and self-regulate. And so often, it's the American way to turn to a substance to kind of regulate the nervous system. Of course, when we use, a mood-altering substance, it never really provides that kind of stability that we're looking for, right? It brings in its problem all by itself with it having a high and a low. So those have really been the things that we've seen. We've tried to respond by bringing United Counseling computers to different, we're calling them UCS hubs. We've got them in different areas in the community so people can have fast access to us. We already provide same-day access, so if someone calls, they're getting immediate care. And then the follow-up for they're having an assessment that day, but then the follow-up appointment is really rapid too. We have delivered harm reduction bags for people that are using or abusing opiates. So we have those, we've delivered them to many community partners, and that has Narcan inside those bags and also fentanyl strips for people who are regulating through all this stress through using. And so it keeps them safe during this period. It's tough because it's not letting up. You had talked about there being a second wave, and that is certainly on people's radar. People are feeling that. It is pandemic fatigue for sure. And again, it is the American way to self-soothe through substances. And so we really have to meet people right where they are. And sometimes it's not full abstinence, it's harm reduction. How can we, if this is something that you feel like you have to do right now, how can we keep you safe and maybe also include other healthy strategies to help regulate through, and we have a vast number of grounding, supportive mental health techniques that all of our clinicians use in every session.
Have you been able to add staff to meet this uptick in demand, or are you still kind of trying to, you basically make do with the number of people you have on staff?
Well, that's a complicated question.
Oh, okay.
Sorry, but yeah, because we would love to have more staff. The problem is that we run in a capped system. So unlike the medical world, where they can see anybody who needs to come in, and they can bill insurance and they have funding, our mental health services through the designated agency and through UCS are capped. So once we reach our cap and our funding, we don't receive any more funding, even if the demand continues to come in. And we see a significant demand. And we are trying to do some things to be able to respond to that demand so people aren't waiting. But we're finding it more and more difficult to respond to the demand because the staff that we have are the staff that we have.
I was also wondering about, in addition to substance abuse issues and opioids and what have you, general mental health questions. I mean, I know that's a big area for you as well. I'm sure there must have been a lot of people, who were struggling with the pandemic or were struggling before the pandemic, and that added a whole other layer of complexity into things. Have you been getting a lot more calls from folks seeking your help and services for that reason?
Absolutely. And chronic stress doesn't just impact the health, right? We know that it creates heart disease and but it really has, we've seen a heightened anxiety, depression. People are reporting grief, and post-traumatic stress even was some of the things that are happening, just living in that heightened state of fear. When I think of, I don't know if you know Stephen Porges' work at all. He is a brilliant scientist, and he really talks about the nervous system. On our 10th cranial nerve, we have, 3 nerves that kind of go through our body that make up the nervous system. And so we have what's called the parasympathetic dorsal vagal system, which is that kind of collapsed system. You kind of can't get out of your way. You're immobilized. We're seeing a lot of that, depression, kind of a shutting down. People just can't seem to do the parenting they need to do or make decisions. They're having a hard time concentrating. That's in that system of, we call it kind of playing possum. And then if you move up the nervous system a little bit, it's the sympathetic nervous system. And that system is reactive. It's the irritability, it's the arguing, it's the, feeling overwhelmed and the racing thoughts. And so a lot of people are living in that system where the vibration is really, it's creating sleep disturbance and it's creating conflict with loved ones. And so we're seeing a lot of that. And so really the job is to move up through the ventral vagal nerve, which is the nerve that runs through our face, up through our neck and our face. And that's where we can soothe ourselves and make some good choices about how we're going to care for ourselves. Are we going to go for a walk? Are we going to listen to some music? Are we going to do some meditation, perhaps some yoga? That's really what we're trying to encourage, cultivate, this sense of self-care for all of us. And, I'm so glad you asked about the providers here, because they are seeing more. This is the highest number of intakes we've ever done. So they are working around the clock.
I was just wondering, with the holiday season coming up, is that adding an extra level of complexity into the equation? I would imagine, just sort of coping day to day through the year up to now has been hard enough. And now we typically get to a time of year when folks tend to get together and all of that, and that's being sort of discouraged, so that the spread of the virus is minimized as much as possible. But I imagine that too must be another factor where instead of folks being able to get kind of some of the family support that they might have had at another time, that won't be a factor either. Is that anything you guys are concerned about, or is there another way of looking at it?
Well, I think I can talk about the some of the staffing concerns. So we certainly have a concern for staff getting together with family, getting together with people from outside the state, and interacting, because we've we have probably about 60 to 70% of our staff are still working remotely. And so we have continued to stay in what we've called readiness mode. So we're kind of at the ready to even shut down further if we need to. But we've, through this whole thing, have been providing full capacity services. And part of doing that is that we've been really cautious. We take our temperature every day before we walk in the building, wearing masks in public, in public spaces. And so when the holidays come, we know there's a possibility of more people getting together, regardless of whether or not we kind of discourage that or throw in some caution. And we require our staff to quarantine for 14 days before they come back to work. And so some of that, our concern is, what will that do with the pandemic internally for our staff to make sure that we are able to care for our folks? And then what does the requirement for quarantining do to make sure that we are also continuing to care for our folks? Because we provide 24/7 care in group homes, so we need to have staff who are healthy and present. So there's a little bit of concern from that perspective. Laura, do you want to talk about client care and anything else?
Sure. I mean, when I think of, I'm so glad you asked that question, Andrew, because even yesterday I was outside raking the leaves, and my neighbor wandered over and was talking about the fact that they don't think their kids can come home for Thanksgiving. And so there's a lot of grief, and we have to validate and acknowledge that things aren't the way they used to be. And so people they're suffering, they are lonely, they are worried. This is chronic. We've been going through this since March. And by the way, it started here in February. So it's really been a very interesting ride, right? So I came here, all my staff was here, and then a month later, we're all becoming experts in Zoom meetings. So it's finding that lining of hope, right? That there is hope. That yes, it's different. It's not going to be different forever, but for this year, maybe it will be smaller. Maybe it will be more intimate. But how can you make it playful? How can you make it memorable? And so really, you're sounding like a clinician right now. So these are the things. You have to meet people where they're at. You have to validate their sorrow, their chronic stress. But at the same time, these are opportunities for people to see things differently and have experiences that are just as important. And I think that really what it's calling us all to do as a nation right now is, how can we all become better at supporting each other and being available in ways that we offer hope, just like you said. It's not 20, it's 3 or 4, but that's not so bad, right? How can we do that for people, that we can bring light into this time of darkness? Mm-hmm.
I was wondering, have you been forced to have more of your counseling sessions with your clients on Zoom or remotely, as opposed to, let's say, in person in an office, where I would imagine the communication is a little more intimate and maybe more revealing? Has that been something you've seen? Anything different in terms of the communication happening, or is it really just kind of about the same?
Well, I had to be honest with you. So it is true that I'm seeing my clients. They have a choice between Zoom or in person. I already had someone in person today. I'm comfortable being in person. We both wore our masks. We both keep 6 feet, distance. Not all clinicians can. Some of them are more health compromised, and so they don't have that choice. But what I will say is that in terms of intimacy and being able to be vulnerable with one another, I see Zoom, and I think the statistics are showing Zoom is just as effective. And if anything, they're in their home. Maybe I've seen too much, right? They're in their home, they're in their jammies, they're eating, they're drinking their coffee. And the reality is that I don't see a barrier. I see, we're very connected. I'm able to make eye contact, although I will be honest right now, you're just above my screen, so I look like I'm looking over you, but I'm actually looking right in your eyes. So those are the kinds of, and we talk about that, right? Some people will say, I don't like that you're not looking at me, so I have to look just away from them a little bit so they can have the experience that I am looking at them. But these are the kind of fun things that you figure out along the way. But I have to say, I don't think Zoom treatment should ever go away. I think we're accessing more people that maybe would never have gone into treatment, but because they're in the privacy of their own home, I just think it's been a wonderful thing that the state of Vermont has allowed us to do to continue to support people. And we have to figure out ways that we can have the elderly have Zoom connections and be able to meet, their needs. I'm not sure we're doing that 100%. That's a mission I have.
I'll jump in too. We did a survey of folks receiving the Zoom clinical services, and a majority of them said, I really like it. We should have done this sooner. I hope this doesn't go away when COVID goes away. We have been able to access folks who would have a hard time getting into the office because either, particularly now, if they're homeschooling their kids, they at least could be in another room while their kids are still home, so they're able to continue their services during the day. So it's really allowed, again, it's that silver lining thing that we know that doing telehealth, we have been shot forward 5-8 years in the future as a result of COVID. And that I hope the powers that be understand that this has really provided a great opportunity for people to access services, and will continue it post-COVID.
Yeah.
You sort of answered or anticipated one of my questions, which was the long-term impacts of all of this. That certainly sounds like it's going to be one, and I know in our business here too, it's hard to imagine us kind of going back just to doing things the way we used to do.
That's right.
7 or 8 months ago. But I guess I just wondered, are there any other long-term effects you're going to see coming out of this pandemic that maybe wasn't on the radar screen back last March?
I certainly think that we are in a, we talked about a COVID surge. We are in a mental health crisis, in a mental health surge at this point, where we will see, I think, years of consequences from the pandemic. Children, really very concerned about children and their feelings of being isolated and being at home and not being a part of their peers and learning how to be a part of their peers and what they're missing educationally. The Zoom has given a great opportunity to stay connected, but it's just not the same. So very much concerned about kids right now, families and issues that are going to come up, the trauma that comes from it. So there definitely will be consequences of this. And I think worldwide, we're experiencing it all worldwide. And the hope is that there will be funding and resources provided to mental health and substance abuse treatment centers like UCS and others, because we will need it in order to be able to respond to the needs of folks. And it may very simply being folks coming in because they are feeling that anxiety and that feeling of, I'm not quite sure what's wrong, something's wrong. And they'll want to connect, and we need to be there for them when they're ready to connect. Lori, something else for you?
I'd like to add that we are responding, UCS is responding with new measures. So what we're going to be doing is implementing an intensive outpatient program that's starting on Tuesday. So it'll run Tuesday, Thursday, and Friday from 9 a.m. to noon. And this is an intensive mental health and substance abuse treatment program for people that are struggling and an hour a week is not enough, or they continue to be at risk because that's the level of care that is not meeting their need. So please, we are hoping that providers in the community refer people We've reached out to our community partners to let them know that that will be starting this coming Tuesday, tomorrow, the 10th of November, and we'll run open. So if there's referrals down the road, we'll be accepting them into this level of care.